Hello everyone and welcome to our presentation created by Sara Al Waked, Fatimah Alabdulaal, Bashaur Alharazi, Howrh Alsinan, and Mayssam Ammar. In this presentation, we will be teaching you about sleep-wake disorder, and our main focus is going to be on sleep paralysis as it represents one of the many types of sleep-wake disorders. We are going to start off with a short video that is briefly explaining what sleep-wake disorder is all about.
I'd like to know how many of you have ever woken up unable to move or cry out, can't move a bit, can't say anything.
And sometimes I was scared to even go to sleep because I would wonder, is this the night it's going to happen to me? I don't know if I can deal with this again.
And I was like paralyzed to the bed. I couldn't move. I'm laying there on my back, and I just felt this heavy weight, like something was holding me down, keeping me from moving.
We erased knowledge of these experiences from the cultural repertoire while the experiences were continuing to happen. That is dramatic. That's a level of social control that's very impressive.
I'm pretty sure he's male because he has tried and has had sexual contact with me.
Whatever it is, and I can't, and I'm praying and I'm saying, you cannot take me. I am not yours. I belong to Christ.
I thought I was dying. I thought I was going to go. I was in some limbo somewhere, and that's the state I was going to be in.
Why is it that some people think that this can kill? Well, first of all, it feels like you're going to die.
Yeah. Hey, come on.
Sorry,
Come
I'm
on.
sorry.
It's okay.
But patients will frequently go to physicians, talk about this sort of thing, and they'll be thought to be psychotic.
Not able to speak, it felt like your lips were sewn shut and your body was totally numb. Then I felt he was coming.
A remarkable number of previously healthy men were dying in their sleep, and on autopsy, no cause of death could be found.
We are going to start our presentation with the introduction and history, the symptoms, the causes, followed by treatments and interventions of sleep paralysis. So moving on to the intro. What is sleep-wake disorder? The definition of sleep-wake disorder, according to Reynolds and O'Hara, is that sleep-wake disorder consists of many different disorder groups. These subgroups are describing some behavioral phenomena that occurs during any stages of sleep, which results in the disturbance in quality of sleep, which affects the individual's normal body movement. DSM-5 classification. The DSM-5 has classified sleep-wake disorder into 10 disorder groups as shown here in the slide. The DSM-5 classification of sleep-wake disorder aims to facilitate the differential diagnosis of the different disorder groups and to help determine the severity of the case. Each disorder is represented by the individual's complaints and dissatisfaction of the quality and amount of sleep during the daytime or night. The dissatisfaction of sleep is related to distress that the individual may be facing during the day. During sleep, the brain cycle is still functioning. The wakefulness of the brain is divided into two behaviors, non-rapid eye movement sleep and rapid eye movement sleep. However, REM behavior is more prevalent than NREM. REM sleep behavior is associated with neurological conditions. What is sleep paralysis? Sleep paralysis is one type of REM sleep behavior. REM occurs during the awaking from sleep, which influences the muscular atonia. The individuals in this case are unable to perform voluntary movement, unable to speak, nor are they able to breathe. It tends to occur in the onset of sleep or in the awaking. This feeling only lasts for a couple of seconds to minutes. However, it can be aborted if someone else touched or spoke to that affected person. The individual may feel the presence of something threatening or may feel fearful in that current state, which is related to visual hallucinations. Furthermore, according to Sharpless, sleep paralysis emerges from a dream activity and results from the transition from wakefulness of the brain to sleep during the REM. So now we're going to talk about the history of sleep paralysis. History and culture. We are going to discuss this image on the left, created by Henry Fuseli, known as the Nightmare Painting. And this is one of the most historic paintings which discusses the issue of sleep paralysis. As you can see, this is what the individual may feel like during sleep paralysis. When the individual is lying on their back, they may sense the presence of a demon sitting on their chest, which makes them unable to breathe, speak, or move. This image on the right is quite interesting as it illustrates sleep paralysis as a myth in many different countries. Kanshabari, which means to tie with an iron rope in Japan, they believe that the Buddhists have the ability to use magic called Fodu Mayo in order to paralyze others by tying an iron rope around their neck. The Japanese believe until this very day that this is a result from evil spirits. The prevalence of sleep paralysis. About 7.6% of the general population have experienced sleep paralysis at least once in their lifetime. Women are more likely to experience sleep paralysis than men. Non-white individuals are at higher risk of experiencing sleep paralysis compared to white individuals. So moving forward to causes and diagnosis. There are two forms of sleep paralysis. The two forms are predormital and postdormital forms. So as one begins to fall asleep, which is known as the predormital form, the occurrence of sleep paralysis at this stage is normally linked to narcolepsy, a sleep disorder which is characterized by an intense desire to sleep. During this period, a person's body relaxes as he or she starts to enter and pass through the various stages of sleep. At this time, the mind stays conscious, and with that awareness that sleep is just about to occur. However, the person is not able to react through speech or movement. When one is awakening from sleep, which is known as postdormital, this is the most common form. The causes of sleep paralysis include insomnia or sleep deprivation, disruptions to the regular pattern of sleep, increased usage of stimulants, excessive physical exhaustion, mental conditions such as bipolar disorder or stress, the existence of other sleep disorders like narcolepsy, or using some medications such as those used in treating ADHD. How the media has portrayed sleep paralysis. A host of writers have portrayed sleep paralysis as caused by a demonic attack. There are accounts of many people who assert that during their moment of sleep paralysis, they felt an evil presence in their bedrooms, with even some claiming to have seen an accosting spirit. For instance, Celine gives an example of a person named Jason who details his encounter with a perceived demon and a possible occurrence of sleep paralysis episode. However, this synopsis could be false, as people often fail to realize that it is the brain that somewhat fails to appropriately adjust through these various stages of sleep, an assertion also noted by the Mental Health Daily. Concerning stigma, so many people who have had this experience believe that they are encountered by a demon. There would be a high tendency for people to stigmatize sleep paralysis as a demonic activity. Additionally, for the more superstitious people, they would tend to stigmatize anybody they encounter with such a problem, believing that they are affiliated with demons. Symptoms and characteristics. The symptoms of sleep paralysis include being unable to move, unable to speak, terror or anxiety, sense of weight on the chest or abdomen, hearing something or somebody, sign of somebody present, see something or somebody being touched by someone. And it's also noted that the first experience of sleep paralysis is tended to occur during the pre-adolescent and adolescent period. Situational factors. A study has been done to conduct the effects of position and timing in the incidence of sleep paralysis. The study clearly verified the traditional belief of how lying in a supine position is related to sleep paralysis. Sleep paralysis subjects are more likely to be in supine position when normally falling asleep than non-sleep paralysis subjects. However, supine positions were more frequent among that consistently reported sleep paralysis at the middle or end of sleep than those reporting sleep paralysis at the beginning. So, avoid falling asleep in supine position will help those individuals to prevent episodes of sleep paralysis. Treatment and intervention. Types of treatments. There's no actual medical treatment for sleep paralysis. The best way to treat it is for people to adopt healthier sleeping habits, unless people are experiencing recurrent episodes of sleep paralysis where treatment can be offered. The first type of treatment, we see that people can take antidepressants or serotonin reuptake inhibitors. These medications aid in the mechanism of action in the suppression of REM sleep. Also, it has been found in a clinical research of isolated sleep paralysis where it was noted that fluoxetine, which is an example of an antidepressant of selective serotonin reuptake inhibitors, was being tested on a double-blind crossover study on 10 patients suffering from sleep paralysis. It was found that fluoxetine reduced episodes in 7 patients. The second part of the treatment is known as psychotherapeutic, and there are 2 different types where you can visit a psychiatrist who can help in learning about the condition and about the different mood changes. In addition, the psychiatrist can help patients with sleep paralysis to cope with frightening hallucinations and catastrophes. Another way is sleep hygiene, which is changing some of your sleep habits. For example, try to adopt a sleeping pattern with strict times of going to bed and waking up. For some people, sleep on the side and not to your back. Moreover, research has shown that caffeine and alcohol disrupt the sleep cycle, so avoid drinking caffeine and alcohol before bedtime. Avoid eating heavy meals. Drink herbal tea or a glass of milk, which will help aid in sleep. Turn off electronics and try to relax and breathe normally before sleep, which can reduce the length and intensity of sleep paralysis. Sleep paralysis is different from person to person, so not everyone experiences the same thing or not everyone needs the same treatment. The third type of treatment is medication and relaxation, which is used as an intervention method, and this will be explained further in the video in the next slide.
For thousands of years, people have practiced meditation for spiritual, emotional, and physical well-being. But from a scientific perspective, how exactly does meditating affect your body? Does it really do anything? It all starts in the brain. During meditation, brain scans see increased activity in regions directly correlated with decreased anxiety and depression, along with increased pain tolerance. The default mode network in particular is activated when one's mind is at rest and not focusing on the outside world, and has been found to improve memory, self-awareness, and goal setting. Want to be more caring to your friends and family? When scientists compared the brains of Buddhist monks to new meditators, they found the region of the brain associated with empathy to be much more pronounced in the monks. It also literally changes your brain waves, and we can measure these frequencies. Meditators have higher levels of alpha waves, which have been shown to reduce feelings of negative mood, tension, sadness, and anger. And if that wasn't enough, it also physically changes our brain shape and size. Studies found that after 8 weeks of a meditation program, gray matter was more dense in areas associated with learning, memory processing, and emotion regulation. And yet the amygdala, which deals with stress, blood pressure, and fear, had decreased gray matter. When we look at the entire body, not only do we see decreased blood pressure, but it can also increase the variability of your heart rate. And while this may sound harmful, it actually plays a critical role in properly transporting oxygen and carbon dioxide throughout your body. Think you're getting sick? In a study where both meditators and non-meditators were given the flu virus, meditators were able to produce a greater number of antibodies and had increased immune function. If we go a little deeper, we can even see changes on a cellular level. Your chromosomes have protective protein complexes called telomeres, which help reduce damage to your DNA and lower cell death. And a shortened telomere length has been linked to several diseases such as cardiovascular disease, diabetes, Alzheimer's, and cancer. Amazingly, when cancer survivors completed a meditation program, their bodies showed significant increases in telomere length. It's believed that psychological intervention, particularly decreasing stress, has a direct effect on the enzyme telomerase, which has been shown to counteract shortening by adding DNA to the shrinking telomeres. Of course, meditation is not a substitute for other medical advice or a healthy lifestyle. We don't want you leaving this video thinking it will cure cancer. But much like hitting the gym can grow your muscles and increase your overall health, it seems that meditation may be a way of working out your brain with extra health benefits. And since your brain controls, well, all of you, why not relax and say, every once in a while. And if you like working out your brain,
as seen in the video, meditation is defined as the reflection upon sound, the visualization of breathing, movement, or attention in oneself to increase awareness of the present moment while reducing stress, and to promote relaxation and enhance personal spiritual growth. One of the first causes of sleep paralysis is stress, which is usually from lifestyle, work, social life, all which cause tension to a person, affecting their sleep cycle. Research has shown that meditation, relaxation helps to understand and stable an individual's emotions and allows the meditator to experience intense emotions fully while simultaneously maintaining perspective of themselves. This allows to gain a greater insight and understanding about one's thoughts, feelings, and actions. Meditation facilitates a greater sense of calmness, empathy, and the acceptance of oneself and others. Also, in the video, meditation helps to reduce stress. Therefore, it helps patients with sleep paralysis to reduce their chance of having difficulty in sleeping, and help patients with sleep paralysis find an easy way to adopt a healthier lifestyle and sleeping habits. Meditative practice have been reported to improve functions or reduce symptoms in patients with some neurological disorders. Also, meditation relaxation has improved health and quality of life. However, research is needed to be a gold standard to support the treatment recommendation for sleep paralysis. Conclusion. We can conclude that sleep paralysis is a disorder that occurs when we are about to enter rapid eye movement sleep. During this time, our bodies become paralyzed in order to stop us from acting out our dreams, but our mind is awake and experiencing horrific hallucinations. This could lead to insomnia and depression, as people may begin to believe they have been possessed by demons. Overall, sleep paralysis is a harmless, naturally occurring experience. Most of the time, sleep paralysis has been reported to be a frightening experience. The treatment for sleep paralysis is limited but can be dealt with actively taking part in interventions and or medications. Thank you for watching our presentation on sleep-wake disorders. I hope you enjoyed it, and if you guys have any questions, you may email us at uoit.net. Thank you.